Hello, I'm Dr. James Schantz. I'm a doctor of chiropractic. I've been practicing since 1987 here in the Roswell, Georgia area. And I'm here today to help share with you some insights on lumbar disc syndromes. So today what I'd like to do is help you understand a little bit more about what a lumbar disc is, what are the symptoms when a lumbar disc starts to fail, what are the causes of disc problems, what kind of exams and tests you may encounter, treatment options, and prevention. A lumbar disc is the cartilaginous pad that sits between the bones of the spine. The bones of the spine are separated by this disc, and the disc helps to act as a spacer as well as a cushioning device. And it helps to protect the spinal cord and helps to give cushioning for the spinal joints as your body moves. Now, these discs are similar to a jelly donut. It has cake on the outside and it has jelly on the inside. What can happen is, as long as this jelly stays well within the confines of the outer part of the disc, things stay relatively happy. But what can happen is, just like when you're eating a jelly donut, the jelly can start to ooze. And when it oozes, it can start to impinge on nerve endings. And that doesn't feel very good. So over here we see the beginning of what's known as a bulging disc. Bulging discs are very common. They don't always cause symptoms. When a disc starts to bulge and actually herniate, and it starts to crowd onto nerve endings, that's when it starts to cause pain. Over time, the disc, if it's kept like this, the disc material can start to wear out. And that's when you start to get what's known as disc degeneration. That's where the disc becomes hard, it becomes thin. We begin to see and feel what are called bone spurs developing. So what are some of the symptoms that one might experience when you have disc problems? Well, there are about 8 different things that can happen. Probably the most mild symptom is stiffness in your back. Moving up the scale, one might experience muscle spasms. They may be short-lived or they may be more sustained. There may be an episode where you bend over and you really can't straighten back up, where you actually feel physical limitation. You may find that your spine gets stuck in an S-shaped configuration. Symptoms may start to go away from the spine and start to affect the buttock or the leg. This is because the nerve endings are compressing upon a nerve bundle from your lower spine, which is most commonly the sciatic nerve. If we look over here at the spinal nerve chart, we can see these are the lower portions of the lumbar spine, those in the lower back. In yellow here, these show the nerve endings. If the discs are pushing back on any of these nerve endings, it can start to cause pain, numbness, tingling, or weakness anywhere across the course of the nerve. So it can affect the hip, the buttock, the thigh, around the knee, into the calf, all the way into the foot. There can be muscle weakness, not only pain or lack of sensation, because these same nerve endings supply the muscular control to the buttocks, the thighs, the knees, the legs, and the feet. There can be a sensation of numbness, tingling, crawling, tightness, and if it's severe enough, a disc can actually press on the nerve endings that go to the bowel and the bladder, can lose control. Now, what are the causes of lumbar disc problems? Well, you don't have to have any acute severe injury or trauma in order to suffer from problems with your discs. Part of the human condition is that after the age of 25, we start to lose the blood supply to our discs. So because the blood supply goes away, there's no longer nourishment and oxygen being pumped into the discs. So they start to undergo physical changes, wear and tear, which can lead to herniations and degeneration. Now, some of the things that can accelerate or exacerbate the damage to the discs. One is poor posture. People that are sloppy in their body habits, they don't bend properly, they slouch a lot. This puts excessive pressure on the discs. Improper lifting and twisting, not bending the knees, bending over at the waist, causing accelerated forces that concentrate themselves on the spine. Also, smoking. Smoking actually decreases more of the blood supply. So again, you have an oxygen-starved environment. And if you're obese, that excessive weight also puts pressure on the lower spine. Now, how does a doctor know if you have a lumbar disc syndrome, some kind of problems with your lumbar disc? Well, there are exams and tests that can point to the source of the pain. First off, history has to be done. Discussion with your healthcare provider about the type of pain you have, its location, what makes it better, what makes it worse, previous episodes. This helps to paint a picture for your doctor. After that is inspection. You must go ahead and look at the area that's involved, see if there's any signs of muscle spasm, any changes in muscle tone, any changes in the way you bend, you move. Third is palpation, actually feeling the area of involvement and seeing if there's any tenderness, any excessive heat, swelling. The fourth is range of motion. That is your flexibility. Typically, there is a reduction in flexibility. Typically, it's difficult to bend forward or bend back, a little easier to twist from side to side. There are orthopedic tests. These are tests that are done to put pressure or strain on the suspected area of involvement. One of the gold standards for a lumbar disc problem is what's called the SLR, or the single straight leg raise. The straight leg raise is performed with patients lying on their back. The doctor lifts the leg that is in a straight fashion up towards the ceiling, and this stretches out the sciatic nerve, and if there's a disc herniation and it's pushing on that nerve, there's going to be an increase in pain at a certain level. X-rays can be performed. Advanced imaging such as MRI can be helpful as well to identify the cause. So once you've identified that there is a lumbar disc problem, what do you do to treat it? What do you do to help? Well, we have a saying in the chiropractic profession. It's chiropractic first, drugs second, surgery last. And this is a pretty good model to follow because it's been proven that non-invasive, non-pharmaceutical methods tend to do very well in helping reduce the pain and promote healing in lumbar disc syndromes. There are different types of manipulation that can be done to help to ease the pressure that is put on these lumbar discs. It can be done through a table like the Cox maneuver. It can be done through manual manipulation. There can be instruments that are used to adjust the spine. Many times modifying activities, decreasing the amount of sitting, decreasing bending and lifting. Braces that are wrapped around the waist can be helpful, as well as exercises to help with decreasing spasm and increasing strength. In terms of prevention, we have another saying: an adjustment today keeps the surgeon away. So keeping a healthy spine is going to be advantageous in preventing disc problems from becoming an accelerated problem, keeping them under control. Exercise on a regular basis to keep your spine stretched and strengthened. Being careful about maintaining a healthy body mass index, not getting overweight. Stopping smoking or not starting smoking is good. Using proper body mechanics for when you sit, when you drive, when you do chores around the house, and keeping your body well hydrated with water. So if you follow these recommendations, you're going to find that you're going to be in good hands when it comes to handling lumbar disc syndromes. Thanks.